Esperando igual. Okay, so hello everyone. Thank you for joining us today in this webinar to discuss the situation of the COVID-19 pandemic in Brazil. My name is Ziman Musa. I am the Associate Director of the Washington, Brazil office, which is the advocacy arm of the US Network for Democracy in Brazil. For those of you who are not familiar with the organization, we are a network. We are a democratic and a non-partisan network, which today has over 1,500 Brazilians and American citizens in the US who are concerned about the human rights and environmental threats that Brazil has been facing over the last years. So we work on different fronts to advance progressive causes in Brazil and stop the ongoing human rights, democratic, and environmental setbacks that have been taking place. And in that sense, given the catastrophic mishandling of the pandemic in Brazil, we started a campaign to request that the US send vaccines to Brazil to slow down the spread of the virus, among other measures to help support the country overcome the pandemic. And as part of this campaign to pressure the Biden administration to lead a global vaccination program, paying particular attention to the situation in Brazil, we are hosting this webinar today. So we're very happy to have Professor Sidney Chalubi moderating this conversation with Professor Márcia Castro and Adriano Massuda. So I would like to pass it over to Professor Sidney now.
Okay, thank you. Good evening, everybody. Thank you, Márcia and Adriano, for being here. Thanks, Iman, for the introduction. Let me introduce the speakers today. First, well, maybe I should introduce myself. I'm Sidney Chalubi. I teach history at Harvard. So the speakers today are Márcia Castro, who is the Untitled Professor of Demography at Harvard and Chair of the Department of Global Health and Population at the Harvard Chan School of Public Health. Márcia is a demographer who studies geographical and demographic distribution of infectious diseases, particularly malaria. She is interested in the interaction between socioeconomic status, individual behavior, local ecology, geography, and health in urban areas in Africa and rural areas of the Amazon. And we have Adriano Massuda. Adriano is a medical doctor, graduated from the Federal University of Paraná. He has a master's degree and a PhD in health policy and planning from Unicamp, from the University of Campinas, my old institutional home in Brazil. He has a lot of experience in public administration. He was head of staff in the Ministry of Sports, Deputy Executive Secretary of the Ministry of Health in 2011 to 2012, Municipal Secretary of Health of Curitiba from 2013 to 15, National Secretary of Science, Technology, and Strategic Inputs at the Ministry of Health. And he now teaches at Fundação Getúlio Vargas. So our main theme is vaccination, but of course we are going to talk about COVID in more general terms too. Márcia, please, you have the floor.
Thanks, Sidney, and thanks so much for putting together this panel and for inviting me. So, so the topic of the conversation, the main topic, is the importance of vaccination, and it's quite timely to talk about this because just yesterday, June 9, was World Immunization Day. So let me just start with 4 reasons of why vaccination is important. So first and foremost, it saves lives. proportion of COVID deaths among all deaths occurring at ages 80 and plus in Brazil has been around 25% to 30% since last year. And it only started to decline now with the vaccination that was launched in January. So by mid-April, this percentage was reduced from 25% to about 13%, and it's probably even lower now. If we look at mortality rates between people over 80 years old and people 0 to 79, and we look at mortality rates due to COVID, they were about 13 times higher among 80 and plus compared to 0 to 79. And again, by mid-April, they were like 7 times higher. So this is all going down. And although it's very preliminary results, we can clearly see just in Brazil, despite the sort of slow deployment of immunization, it's making a difference, it's saving lives. Second point is that if the vaccination is done well, quickly, and with good coverage, we can achieve community protection, also called herd immunity. I just don't like those words. I think community protection is better. And it can bring down transmission to very low levels, which would allow the country to effectively go back to almost regular activities with caution. Unfortunately, Brazil is moving too slow on COVID vaccination since the doses that we needed were not secured last year. And that's actually one of the reasons or one of the topics being discussed in a parliamentary investigation going on in Brazil right now. Just to give you an idea, the US was vaccinating about 4 million people per day last month. Now it's a bit lower. Many cities are now in the US relaxing restrictions given the very high coverage. On June 6th, June 6th, so just a few days ago, China was able to vaccinate 14.8 million people in one day. And Brazil does have the expertise and the experience to do a much better job than it's doing. And just to give one example, in 2010, Brazil managed to vaccinate 88 million people against H1N1 influenza in just 3 months. Third point, and related to the previous one, is that the faster we bring down transmission and contain the now largely a mitigated pandemic in Brazil, the lower the likelihood that new variants would emerge in the country, and those variants potentially could be more transmissible, more lethal, and could evade immunity acquired through a previous infection or through immunization. In other words, countries with high transmission lagging behind on vaccination, like Brazil, are potentially a threat to global health security. The fourth and last point I want to mention is that given the lack of a coordinated response since the beginning of the pandemic, which contributed to the dramatic situation we see in Brazil now, and the unacceptable and devastating loss of lives, a fast immunization of the population is, at this point, the light at the end of the tunnel to turn around the humanitarian crisis we have in the country. This task will never be what it could have been, because Brazil failed to secure enough doses last year in order to vaccinate the larger number of people in the shortest period of time. Yet, it's never too late to do the right thing and to save lives. So again, 4 reasons to get us started. It saves lives, it promotes community protection, it reduces transmission and the chance that new variants will emerge, and it is the best way forward to move Brazil to a sort of controlled stage of the pandemic. You're on mute.
That always has to happen. After a year and a half of Zoom, it still does. So Adriano, thank you, Marcia. Adriano, please.
So hi, Professor Sidney. Hi, Marcia. Hi, Iman. Hi, everybody who is watching us here. I would like to thank you a lot for this invitation. It's a very great pleasure to be here, to be part of this initiative of U.S. Network for Democracy in Brazil. During the time that I was in Boston, I could be part of some initiatives that was very important at that time to discuss democracy in Brazil. but now such as initiatives become much more important because we are facing not only a sanitary crisis, but a political crisis, and one is totally related to another. So I think Marcia already, in this brief introduction, give us 4 important reasons for of vaccination for addressing COVID in Brazil. I will put another element is that we need to have vaccines, but we need to do the vaccination. And to do that, we need to strengthen our health system. Brazil has a situation out of control in terms of the transmission, in terms of number of deaths. We are the second highest number of deaths in the world, but in 2021, we are the highest. And the number of deaths, the daily number of deaths currently is above 1,700 since March. So it's a lot of several days that we are facing this kind of situation. As Marcia said, the speed of the vaccination is very low. We will need around 30 days to 300 days to do the first shot for the adult population, and to complete the full vaccination, we will need around 900 days. So it's a lot of time in this speed that that is currently in the country. So and the projections in this situation with the high transmission, with low coverage, the projections for deaths from the Institute of Health Metrics is that we're gonna have more than 700,000 deaths in September the 1st, counting not only the reported deaths, but the estimated deaths that is not reported. So to address this situation, we need to strengthen our health system. And it's important to talk about the Brazilian health system, the SUS, the Unified Health System, in this event that discuss democracy in Brazil, because our system is the product of the fight for democracy in Brazil. We built this system, the values of the system, the values was conceived during the redemocratization of the country, but the solidarity that based our health system was came along with the perspective of the redemocratization. So since the 90s, we did very important progress in terms of increasing access to healthcare in Brazil, improve health outcomes, decrease health inequalities, but several important structural problems of the system remains, such as the public underfinancing, the fragile regional organization of the system. Brazil has a very particular system in the world that as a continental country with more than 5,000 municipalities, and the health system is decentralized to the municipal level. So the municipalities are in charge of providing from public health interventions, vaccinations, for example, to the provision of healthcare. So in a country with very high inequalities, this is very challenging. And the Ministry of Health had an important role in terms of being the authority in the coordination of the system and giving support for the municipality for implementing the policies. So with this organization, from 90s until 2015, several public health programs were implemented. For example, the primary health care, the community health based that we have in Brazil, was responsible for the provision of basic services. And with this kind of organization, we have more than 260,000 community health workers, because this kind of organization, we achieve more than 9,500% of coverage of vaccination for the target population. So the combination of a universal health system, decentralized, even with these structural problems, we did a very good job controlling several diseases. In terms of public health emergencies, we have the capacity, we have public health tradition. Institutions like Fiocruz and Butantan doing a very important job in terms of training public health professionals, doing research. So this capacity is inside of our health system. And because of that, we did a very good job in previous public health emergencies, such as Zika in 2015 or influenza in 2009. But our health system is under threat, not only because of Bolsonaro's government. The threat started since fiscal austerity policies were implemented by the Michel Temer's government. We had a minister called Ricardo Barros, that he said in 2016 that the SUS should be reshaped to be a universal health system in Brazil. In a country like Brazil is impossible, so we need to reshape to fit the SUS in the size of the money that we have available. So we need to shrink the system, decrease the actions that are provided. So we are facing this pandemic with a weakened health system. And this is making the difference in terms of we could doing a much better job. But also, of course, that Bolsonaro government is doing a terrible job in terms of not only decreasing the capacity of the system, but also developing a strategy of dissemination of COVID. So this is a choice that the government do. The CPGISA, colleagues from CPGISA, an institute at the University of São Paulo, just published a report showing the timeline of the events that the government, the federal government, do in terms of doing obstructory measures of state and municipal governments to curb the transmission, omissions in terms of implementing policies. So because of the federal government response, we are in this situation. But in the other side, this SUS is working. So state and municipal governments assumed a leading role in the response of the COVID in the country. So who are doing the vaccination is the municipal governments. We have some initiatives that are very important in terms of facing the federal government actions, such as the tentative to change the data. So there is a consortium with the health secretary of health, with the press in Brazil to release the real information of the pandemic in the country. We have a mobilization of private sector companies doing donations for the SUS. And we have an unprecedented defense of SUS. I think this is something very important that we need to talk about. William Bonner, for example, one of the most important TV presenters in Brazil, said 2 days ago that he got the shot from the SUS and we need to defend this enormous SUS. So this is something really, really important. And in the SUS, we developed one very important initiative, I think Marcia mentioned, in terms of vaccination of a community, of a city called Serrana in the countryside of São Paulo. This project was led by the Butantan Institute, and they showed that doing the vaccination for the whole population of the city, with 70% of the population got the vaccine, with 70% of coverage, we can reduce the mortality in more than 95%. We can reduce hospitalizations in more than close to 90%. We could reduce the symptomatic cases in around 70%. So Brazil is not only the Bolsonaro government or the Bolsonaristas. Brazil is a country where we can see people fighting for democracy, fighting for lives, and fighting for SUS. So thanks a lot for the opportunity to be here.
Thank you, Adriano. So thank you both. Thank you both of you. That was a great introduction to our conversation. I have lots of questions, but I will first start with a kind of a general observation. Being in the US and observing Brazil from a distance, I'm really struck by the contrast. I mean, the two countries started somewhat in similar ways, with negationists in power and tragedies in both countries caused by the lack of engagement of the federal government in dealing with the pandemic. But now we are in a very different situation, right? I mean, in the US, you have plenty of vaccine available, but there is a real danger of COVID lingering on because there is a significant percentage of the population that is not seeking the vaccine. And in parts of the country, I think it is very possible that community immunity, as Marcia likes, is never going to be achieved because lots of people refuse vaccination. And in Brazil, you have the opposite picture. I mean, the public stories, the stories you hear you see in the press, and you see people talking about is of people trying to find a way of getting vaccinated, no matter what, telling lies, inventing reasons to get the vaccine. So the public narrative is quite different in both countries. But my first question then is, because I don't know, it's just a curiosity, because the numbers also show that in the past few years, immunization in Brazil for the diseases that have been normally made available have been declining, the number of vaccinations. Yeah. Do you think, in your opinion, do you think that this decline has to do with what Adriano has just mentioned, which is an increasing precarization of the public health system beginning in 2016, or maybe before, when the crisis was already there, the economic crisis in 2015, and we can trust that COVID vaccine being available, all Brazilians will run to have it, or enough people will? Or is it skepticism about vaccination? Has it become also important in Brazil to the point that in some places we will have a similar problem that we seem to be encountering in the US at this point?
So that's a great question. And part is related to the health system per se. And in fact, one of the things that have been well documented is the fact that in some places, the hours when the units work, they don't open over the weekend, they don't work longer hours. So people that actually cannot, miss a day of work, they don't take the kids for vaccination. And we still have the campaigns, but even the attention that is given to those campaigns, for some years, people didn't even remember Zé Gotinha, right? The Jack Drop. Where is Zé Gotinha, right? So, and suddenly he came back now with a whole family. In the Amazon region, Zé Gotinha was always there. It's right there outside the cars. But, when you go to the larger areas, suddenly the campaigns were not exactly what they used to be. That's something that had been documented. The Brazilian Association of Pediatrics wrote several petitions to change the hours so people could go and vaccinate their kids and all of that. So a little bit of the health system, a little bit of that, but there are studies showing that it's kind of increasing the resistance to take vaccine. It's not a big deal in Brazil yet. However, it is actually increasing among the higher income population, not the low income. The low income population use SUS. They like to get the vaccines. They see the value of the vaccine. So I don't know where this is going to go. I don't know how big this is going to become, but there are actually good studies that were done. I know 2 of those that were done in São Paulo, and it's the high income people that start to have some resistance of vaccinating their kids. It's nothing close to what it is in the US. Not even close. It isn't. But it for something to go downhill, considering the context we have, it doesn't take too much. So we should really be paying attention to that, I think, much more than people are discussing those issues.
Yeah, I think the coverage of vaccination is declining since 2015 in several kind of vaccines. And I think this is really associated with the capacity of the system to reach the people. So we achieved this, not so much countries achieve this kind of coverage. 95% of population, of target population. So to do that, we need to have the primary care units open, close to where the population lives, where the people lives. But also we need to have community health workers to look for the people who didn't got the vaccine and come to bring these people to the primary care units. So what's happening now is that the number of community health workers is decreasing. For example, in Curitiba, city where I'm born and I have the privilege to be the Secretary of Health, the number of community health workers when I left the Secretary was more than 1,200. Currently is 400. So decreased a lot, and in several cities it's happening. So I think this is really associated with the decreasing of coverage in the low income population, and the high income population, as Marcia said, we are observing something not so significant like in US, but there is a part of this happening too.
Well, first of all, I want to remind people who are with us that you can ask questions in the Q&A. You write your questions there, I will be paying attention to it. Second question that I have, another point, which is now there's this conversation about, trying to get donations of vaccines to Brazil. The investigation going on in Congress has shown that the country lost several opportunities to buy vaccines last year, and the situation seems hard to change in the immediate present. So it looks like the picture that Adriano presented to us of vaccinations that are going to take more than a year to be concluded is the perspective that we have now. But I have another question. Suppose that you had a government, that this is really hypothetical. You had a government that decided to do whatever it took to get vaccines now, to abbreviate this period, to speed up the process. And vaccines continue not to be available in the international market. Does Brazil have the capacity to produce vaccines at home in the country to meet that demand? Let's suppose that the patent is finally broken. You can actually copy and you have the technologies transferred. And, is the country able to produce a massive number of vaccines in a short period of time, given that international cooperation takes place and the technology is transferred and so on? What is the real situation in this regard?
So the technology transfer of both Sinovac, CoronaVac to Butantan is, if it hasn't happened, it's happening. And from Oxford AstraZeneca to Fiocruz, it's also happening now. Now, what that means is that they will have everything to produce the primary component, which now it's imported, and then they can produce all the doses locally. Now, the issue is, even if they were able to have the primary component right now, not next month, there is a limit on how many doses they can produce. And in the case of Fiocruz, they have a completely new industrial plant that is working on full speed. So even using what they had before in Manguinhos and this new one that was assembled in order to produce the vaccine, plus whatever Butantan can produce with CoronaVac, that's still not enough to, let's produce all the vaccines we need for this year. There is not enough, and they are working 24/7, non-stop. Okay, they don't stop on Saturday, Sunday, or anything like that. Now there is another industry that was ready. I forgot the name now, but it was ready to produce the Sputnik. I have no idea what's the capacity of daily number of doses that this particular one can produce. I don't know if Adriano knows, but we still need I think Sputnik was recently approved for sort of temporary use or something like that. I don't know how many doses they can produce, but other than those three, we have the Butanvac, but that's still on trial. So that's probably not even something for this year. I don't know. There are other groups. There are at least 2 other groups trying to develop a vaccine. One is Ricardo Gazinelli from Minas, São Paulo, and Jorge Calil is also developing one. But this is going to take time. And both of them had funds cut for research. So when you think of the long-term things that could have been done to put us in a better position, would be invest in the science. Some people forget that. You think that when the emergency comes, oh, let's get some money for science. Science doesn't work like that. It's a long-term process. So the short answer is no. I mean, we really would need to have secure doses and combine with the local production, then would be in a better position. Just to give an example, last year, the US secured doses before any results of phase 3 trial, right? You don't even know if what you're buying is going to be good. They secure enough doses to vaccinate the entire US population twice. Twice. So 4 doses, right? Twice. That's what they did. We didn't do that. So.
I think Brazil is one of the few countries that have capacity of producing vaccine domestically. 90% of the vaccines consumed in the national immunization program are produced here. So it will be a challenge to produce in a very fast speed. So it was a wrong decision of the federal government to put all their money in just one strategy. But I think if we have, we continue investing in the, using the SUS purchasing power to invest in our public and private industries, I think we will be in a better situation. But it's not something that happened from the day to another. It's something that we have a long term, and we had it. We had a national strategy for developing health products in Brazil, doing cooperation with other countries to transfer technologies. We have, during the time that I was at the Secretary of Health, the Secretary of Science and Technology, we have more than 100 projects in collaboration to transfer high-cost medicines to produce here. So we have Fiocruz, we have Butantan, we have this technology, we have this knowledge, better saying. So if, as your question was in another government, in another situation, I think we will have the capacity, yes.
Yeah, it's also important to remember that even though Trump had his comments indicating his skepticism about vaccination, so on and so forth, he invested billions and billions of dollars from the beginning for the research seeking vaccines. So there was a lot of U.S. government investment. So yeah, I mean, it's in the situation we are in Brazil, the counterfactual thinking is almost inevitable. Because imagine if we have a government back there that from the beginning took responsibility, they could have made partnerships, scientific partnerships. It would be in a completely different place. It could be, in a completely different place.
But I think we have one counterfactual, which is you have two governments that the leader, the nice science, say crazy things, pretty much along the same lines. The one difference between the two, one bought the vaccines, the other didn't. But of course, it's not a real counterfactual because then the US changed everything through the vote, right? And you never know what would have happened if Trump was still the president. We don't know that. But still, what would happen, in the context of Brazil, with all the crazy things that were going on, but if we actually had vaccines, it would be better. It wouldn't be great, but it would certainly be better because we would vaccinate more people and save more lives.
And Max, I mean, the consequences of Trump are still here, right?
Oh, yeah.
Because this large number of people were skeptical about getting a vaccine has to do with the anti-scientific bias that he shared with Bolsonaro. Nobody's worse than Bolsonaro, but Trump did his part to produce this result too.
Absolutely.
Yeah, and just dwelling on this a little bit, just because I'm intrigued by this, and then I studied the history of public health for a while, and I did a book on public health in the 19th century, and I'm always kind of struck by the attitude of some medical associations in Brazil. And we've been seeing this actually in the CPI. We actually saw people arguing that they were following recommendations that are accepted by the, is it called Conselho Federal de Medicina?
Is a medical council.
Yes, Conselho Federal. Is it, I don't know if it's the right name. So, and my initial question about vaccination also had to do with this. I mean, you see this kind of official skepticism, right? That is present not only in the government, which you would expect it to happen given the government that it is, but also in parts of the medical profession. There's this mixed feeling. You imagine all those medical doctors out there saving lives under very dire conditions. And you have these people sitting, I don't know where, in Brasilia, Sao Paulo, Rio, whatever, certainly not seeing any patients and spreading skepticism. Why do you have to live with this? I mean, isn't there ways of keeping these people under control or making them accountable for what they are doing? Or, I mean, skepticism about science is something we have to live with, even in professions that should not admit it at any cost.
So Adriano is a physician. I'm going to let him handle that one.
Yes, it's about his
Very
peers.
easy question, Professor. I think first, in Brazil, the accountability of the professions was delegated for their own professions. So we have the medical council that is an autarky that is responsible for doing the fiscalization of the medical practice, and as in any other, as the other professions. In Brazil, what happens is that the elections for these medical councils, the federal and the regional, because we have the federal and the regional by states, the election happened at the same year that the election of Bolsonaro, and the wave of Bolsonaro elected the new members of these commissions, and I think there is an important fight that happened since when Dilma implemented the More Doctors program. I think this is very important to say. That is one of, as Brazil has a decentralized system to the municipal level, hiring doctors is something very hard for small municipalities. So the lack of doctors is an important challenge for SUS, not resolved. And Dilma, to face the problem, developed this More Doctor program, composed with doctors from Brazil, but much more from foreign doctors, 8,000 from Cuba. So this was something that make the medical associations very angry with the government, and this make an organization of these Bolsonaristas doctors, and they elected. So so in one hand, we have this kind of situation now, and I think they're gonna be they will need to press count what they are doing, because they have responsibility to do the fiscalization. I think the congressional, the CPI will do something. I hope so. But on the other hand, we have a lot of doctors working hard to saving lives, and we have very good quality level of medical doctors working in hospitals. So we are, as I said in my initial thoughts, we are in a fight.
Let me imagine something here. Let's try to be happy for a minute, which is, suppose that there were elections and, you know, the new government wants to do everything that needs to be done to fix the health system in Brazil, to actually value this wonderful thing that we have, which is a national health system that originated in popular mobilization and social movements, which is deeply democratic, it's national, it's something that other countries, many countries should be envious about in terms of the general conception of the thing. So let's suppose there's a government that wants to do everything in its power to fix the system. What would you do? I mean, where would you start? What would change? I mean, to fix the problems that does not have anything to do with COVID, and what would be strengthen it from the experience of the past, and where would you go in terms of being a different place when something like this hits us again? So it's just be happy, you know. Imagine that, you know, you could do anything to fix the system and make it work for everybody. Where did you start? What would you do? The question is so crazy that you can't even imagine an answer, right?
You want to
Marcia, go ahead.
You want me to go first? Okay. So I think, well, first of all, you know, just to make us happy, it's important to go back to you know, the end of the 80s when everything started, and when the idea came about, and it seemed crazy, and it was literally what happened was a revolution, not just because it started from the people, but we literally moved from a scenario where if you didn't have a formal job, you depended on the you know, the philanthropic hospital. So you had no primary care, you had no prevention, you only go when you're dying, right? That's what we had before. It's so some people don't remember this, or are too young not to know this. So you know, that's the first thing. It was done before. It was a different moment. It was the moment of, you know, direct elections. We're getting out of a dictatorship. It's a completely different vibe. Correct. So because you asked us to imagine a new government, it's also going to be a new vibe. We're getting rid of this crazy moment. We have a chance to do something right. So I would say, and Adriano can probably give a better answer than I'm going to give, because he was in the ministry before. I'm just a professor. What do I know? But I would certainly strengthen the community base of the program more and more. You know, I work a lot with malaria, so more and more people start to see, you know what, we're not going to do anything if we don't get the community involved, if we don't get the actions at the local level. So we have plenty of examples over and over again, and from different countries, getting things at the local level. Community-based programs, they work. One question is, how are you going to make sure that everybody, that you get people working in communities in the semi-arid, in the middle of the Amazon, places where I do my field work? How do you get people there? So I think that besides doing things community-based, we got to create some sort of network that, so you probably remember the Projeto Rondon. A lot of people don't even remember that. I honestly think that everybody that goes to a public university in Brazil had to be 6 months somewhere in Brazil. Not going to other countries, just go somewhere in Brazil. But if you are in São Paulo, you just don't go to Sorocaba or Campinas. No, you go to the Northeast, you go, and if you are in medical school, you're going to do something related to health or whatever. But you know, you're studying for free. I think it's fair enough you give something back. People would get to know Brazil, because a lot of Brazilians have no idea what Brazil is. Just the Amazon is 60% of Brazil. They don't even know what it is that goes in there. You in some way promote some exchange of knowledge, exchange of, I mean, those people, they are in university, but they can promote build capacity locally. So anyway, I think that there are a long list of things to do. One of them is to fight against the lobby for the private sector I'll let Adriano do that. And that's a big task, but I think I would immediately focus on strengthening the community care, because then you guarantee that you're bringing care to those people that are usually left behind, that have no way to seek access anywhere else. That would strengthen primary care, and primary care is the backbone of any kind of universal health system. So without that, you're not going to go anywhere. So I would start with that and then give the hard task to Adriano.
I would love to work with Marcia as a Minister of Health in Brazil. But I think firstly, we know what works and what not works. So primary care works in Brazil. So with primary care, we deliver services close to where people live. We need to strengthen primary care. We need to prepare our students, our medical students, our health students to be in this setting, because our students are prepared to work in hospitals and not in primary care. So this is an important challenge to train our students. Secondly, I think we need to rethink about the decentralization. I think the decentralization to the municipal level was fantastic to organize the system in a very granularity. So in every 5,500 municipalities, we have a Department of Health. But we can decentralize from public health to healthcare for all municipalities. So I think we need to rethink the governance. I'm working in the city of Diadema, giving support for the Secretary of Health and the mayor. And for example, Diadema is spending 40% of their budget in health. So when a city, and it's not the only city in Brazil, in average, the municipalities are spending 25% of their budget in health. So it's gonna lack money for education and for other social policies. So we need to reorganize the governance. And in this situation, be a manager of SUS today is a professional of risk. You can be in jail because you were not offering a hospital bed for someone who needs, and it happened because you don't have enough money. Or you are be prosecuted because you are spending more money than you have in your budget. I faced this situation. I was Secretary of Health in Curitiba. And third, I think we need to change the mode of care, invest in primary care, think in the governments, but we need to finance the system. In Brazil, we spend around 90% of our GDP in health, is in the average of high-income countries, but the share of the money goes very unequal. 42% of the money, only 42% goes to finance the SUS, where we do vaccinations to transplants. And 58% of the money goes to the private sector, who covers a quarter of the Brazilian population. So SUS do magic, doing from vaccination to transplant. So it's a it's a universal and comprehensive system. We provide several different kind of procedures of services for the population. So is a very singular health system in the world. I think we don't have any other with these characteristics, a very robust public system, and also a private sector that compete with the public. And I think the public and the private gonna still exist in Brazil. We need to try to do a better coordination, a better balance between the funding, the allocation of the resources, and the coordination of healthcare in the public and the private. I think you are mute, Sidney.
Yeah, I think that going forward, I hope two things get better. One is belief in science. I mean, if vaccines in the end prove to be the solution for this situation, when it looks like it is going like this, maybe it is going to undermine belief in the skeptics in ways that can give us some relief from them. And I also share Adriano's initial observations, and now that maybe people will be more interested in defending SUS, defending the system, and maybe the underfunding of it that has been chronic maybe is going to become less of an issue going forward. I have one last question, really quick. How is vaccination going on about indigenous populations in the Amazon and elsewhere, Marcia? Do you know? Because at the beginning, the situation was really dire for the indigenous populations. And how is it going on now? And is the situation better? How is it going?
I think it's better. I don't know what's the coverage, but in the beginning they were not included as priority. Then they were included as priority, and that's when you see how fantastic SUS is. People are going on in boats and doing all kinds of stuff to be able to reach out. So I don't have the data. I don't know how is the coverage among indigenous, but I would assume it's better than the very beginning when they were completely left out. Completely left out.
Okay. I'm sorry, I have so many questions. I can't resist one more to Adriano, to the medical doctor. Is it crucial, you think, to vaccinate children going forward? I mean, this is a conversation that is beginning here in the US. Now they're vaccinating 12 people on, but since they have vaccines, they are beginning to talk about vaccinating children. How decisive can that be for COVID to be under control?
I think this is for Brazil, this is a question for the future. Firstly, we need to
for the distant future.
Yeah, first we need to vaccinate people over 18 years old, the adult population. To do that, we will need to have a long time. And after that, I think, well, let's discuss, because currently all the data that we have for the younger population is not a big deal, the disease. They can transmit, but if they're not sick, they transmit in a low level. So there's for example, the schools is a safe environment if you do the control of the teachers. So it's something that is for the future, I think.
Yeah, but one thing, if you allow me, Sidney, one thing that it's important to keep in mind is that, and there's a study that came out recently from a group in São Paulo, Raquel Ronick, showing that if you look at who are the people dying in the city of São Paulo by neighborhoods, and who are the people that got vaccinated, the highest coverage of vaccination are exactly where fewer people die, the higher income. And then there is a discussion. One, we got to make it easier for people that cannot miss a day of work to get the vaccine. And two, why not take inequality into account, especially in a country like Brazil? And the government is not even wanting to listen to this discussion, but I'm not going to say it's unethical. You know, the philosophers can define ethics. I'm not going to attempt to do this, but not taking into account inequality, it's also killing people that could have been saved. So I'll just leave it at that.
Okay. Adriano, just to the doctor again, because everybody asks that question. Probably they ask you 100 times already. How dangerous is it for vaccinated people to transmit the disease to unvaccinated people?
Well, if you
do we know that?
No, if you got the vaccine, your chance to have the disease is very low. is not 100%, but it's very low. And if you not have the disease, you reduce the possibility of transmission. But this, again, is not 100%. So, for example, the decision in US of not using wearing masks, I think is something very controversial. It's something that I will take care. I think, well, CDC said that it's possible.
I think
So
it
you-
depends on
you-
the type of the vaccine as well. I mean, they did studies with Pfizer, which is a much better vaccine than the majority of vaccines that have been applied in Brazil, although we have Pfizer as well now. And they showed that even when people got infection, they were so mild that they were not infectious. So they're not transmitting to other people. That's why they dropped down the mask mandate. But I'm with you. I'm not dropping my mask yet because I don't know who are the crazy people that didn't get vaccinated. So, you know,
Yeah,
but
I think dropping the mask has to do with not only being vaccinated, but seeing that the level of transmission is so low where you are.
Yeah.
That the likelihood that you are interacting with people who are carrying the disease is also very low. So the combination of these two things is when you can probably, you know, be more confident that you can not be wearing a mask and be safe. So being vaccinated in Brazil and not wearing a mask is out of question because you'll be interacting with people who are carrying the disease all the time.
Yeah.
So it's a different situation. Well, this is a wonderful conversation. I learned a lot. This is recorded, so I'm sure lots of people will be seeing in the next few weeks. And I thank you very much for agreeing to do this. And let's hope for the improvement of the situation in Brazil in the next few months.
thank you, Sydney. And
Thank
thanks
you.
for the network.
Thank you.
Thank
It's a
you.
great pleasure.
Bye-bye.